My name is Ed Bedrossian. I'm an oral and maxillofacial surgeon here in San Francisco. For the past 25 years, I've been involved with research as well as the clinical application of the immediacy concept. And what immediacy means to me is immediate implant placement, immediate provisionalization of these implants, and in the fully edentulous patients, the actual immediate loading of this type of cases. I'm very excited to be involved with Straumann using the BLX implant and having the opportunity to communicate my experiences and my thoughts with my colleagues. One of the main benefits of the BLX implant that one should really appreciate is its surface topography, which basically increases the surface area of the implant and therefore much better bone-to-implant contact. The SL active surface promotes contact osteogenesis and a better bone-to-implant contact and stability of the implant during its healing phase. As a surgeon placing implants for fully edentulous patients, we're all aware of angulated abutments that we need to use, and the consistent implant platform that's available makes me feel very comfortable choosing the appropriate diameter of the implant, knowing that these 30-degree or 17-degree angulated SRA abutments are available and can be easily used regardless of the implant diameter I choose, which is appropriate for my patient. What I would say to my colleagues who are considering immediacy is that they should feel confident using the BLX system, as it has the features for initial stability that's critical for immediate implant placement. Preservation is a lot more predictable than reconstruction, and if we can remove a tooth and place an implant and a provisional in one surgical treatment and prevent the scarring and the contraction of the soft and hard tissues, that is an immense service that we can offer to our patients. This is underscored especially in the fully edentulous patient and the terminal dentition patient who's never been burdened by wearing a removable denture. If we can take the teeth out, place implants, and have it stable enough to be immediately loaded, a patient in one treatment in half a day can have their teeth removed, implant placed, and have a fixed prosthesis, and never have to deal with the headaches and the social as well as the functional difficulties that is inherent when somebody is wearing a full maxillary or mandibular denture.
My name is Edmond Bedrossian, and I'm a prosthodontist in San Francisco. You know, as a prosthodontist, we're exposed to various implant platforms and prosthetic connections, which can make it very confusing when working with the surgeon, with working with the lab techs, or even when working with your own in-office team with communication of what to order and what to have in stock. But with the BLX implant, with having one single prosthetic connection, it allows to simplify everything as far as communication with the surgeon, with the team, as well as with the lab technicians. BLX gives me the confidence to simplify the prosthetic components while providing the aesthetic outcome I'm looking for.
The BLX system gives me the confidence to simplify and use one system for treatment of single, partially edentulous, as well as fully edentulous cases, both in the maxilla and the mandible. I look forward in communicating with my colleagues and having this type of treatment offered to more of our patients.